Good morning, good people of Greenville. I am Kacey Eichelberger. I'm a maternal fetal medicine specialist and the chair of the Department of Obstetrics and Gynecology here at the University of South Carolina School of Medicine in Greenville, Prisma Health. We are seated in my office here on the main campus of Memorial on Ferris and Grove. So wish you could be with us today, and really just wanted to come this morning to have a conversation with you about the vaccine and pregnancy, and any specific questions that you have about COVID vaccination specific to reproductive age, we would be delighted to hear. So please feel free to offer up questions in the chat, and we have some good friends in the room who are going to help feed those questions to me. We did get a few questions before we started this morning, and I thought that would be a great place to start while we're waiting for you to have your coffee and ask some questions. So specific to the COVID vaccination process and pregnancy, so specific to women, some of the questions that came up. First, is it safe to get any vaccination in pregnancy? Great question, yes. So flu vaccines are recommended during any trimester of pregnancy if we are in flu season. We do the inactivated or injectable flu vaccines in pregnancy, and any of your OB or midwifery providers are going to be able to offer those to you. So for sure, vaccines in that space are recommended. The other vaccine that we recommend in pregnancy for all women who've reached 28 weeks, so third trimester or beyond, is the Tdap vaccine, and that is really given for the pertussis component, that P component, which is whooping cough. The CDC recommends that every pregnant woman get that vaccine 28 weeks or beyond for every pregnancy, and the idea is that you are making antibody and passing that antibody across the placenta to protect your little one. So very common practice to give vaccination in pregnancies. In other countries where other diseases are more endemic, there are other vaccines that may be given during pregnancy. Of all of the vaccines known to man, the only one that has ever been proven to be unsafe in pregnancy is the smallpox vaccine. So thankfully, that's not an issue here in Greenville County or anywhere really, and so not anything you need to be thinking about. So vaccination in pregnancy, highly safe. Second question, what do we know about COVID infection in pregnancy? Great question. Obviously, it was a new virus to us within the past year, and so it took many months for us to start getting reliably large data sets to be able to make statements about risk of COVID in pregnancy. We do know that pregnancy can be an immune-compromised state for women, and that other illnesses like flu can be rendered more severe in pregnant women when compared to an equally aged group of women who are not pregnant. What we found over the past 12 months is that is true for COVID as well. The CDC and the American College of Obstetricians and Gynecologists now both recognize pregnant women as being a higher risk cohort who when they are infected with the COVID virus. Women are at higher risk for needing mechanical ventilation. That's a fancy way of saying needing to have a tube, airway support to help you breathe. They're at increased risk of hospitalization, and unfortunately they appear to be at increased risk of preterm birth as well. So here in Greenville, like every other place in the country, OB units are seeing a decent number of COVID infections in women. Some of those women are asymptomatic. They don't know they have the virus. Some women are moderately sick, and some are very severely sick and require ICU care. So we've seen the whole gamut here in Greenville. We've taken care of more than 300 women known to be pregnant and have COVID, many of whom thankfully have recovered, but some of whom are still quite sick. So we do know that COVID is serious in pregnancy. Third question is about breastfeeding. Moms who are breastfeeding and are interested in considering vaccination. And for this, what we have are recommendations from the Academy of Breastfeeding Medicine. That is the National Society, the ABM, that are the fiercest scientists and advocates for women who are lactating. And the ABM has released actually some of the strongest language about the vaccine out there, arguing that women do not need to be encouraged to pump and dump if they receive the vaccine, that they recommend full access for women who are lactating to the vaccine as soon as they're able to get it, and that women should continue to breastfeed throughout. There is no reason for the timing of your vaccination to impact your decision to breastfeed, nor for your breastfeeding to impact your decision about getting the vaccine. So we definitely recommend that women continue to to continue to put baby to breast throughout, and that should not be an impact. Women are donating their breast milk to science. Women who've been vaccinated and are continuing to lactate have offered up. There are actually many folks in the healthcare profession who have been seeking resources to donate their breast milk to science to measure the impact of the maternal vaccination on breast milk measurable antibody level. No data to tell you today from that, but the biologic plausibility is exceedingly low that any of that would reach the baby through breast milk, and if so, it would be digested by the gut. So breastfeeding, check, yes. The next thing is, I'm thinking about getting pregnant. Should the timing of my pregnancy relate at all to when I get my vaccine? And for this, we have the American Society of Reproductive Medicine. That's the group of people who guide the world of in vitro fertilization. So folks who know exactly when they're going to get pregnant because they're working really hard via IVF. And what that group, the ASRM, has said is absolutely no reason to alter your timing of pregnancy around getting your vaccine. Meaning, if you are in the middle of an in vitro cycle, absolutely fine to continue with that in vitro cycle and get the vaccine as soon as you are able. So again, no plausibility behind the argument that the vaccine might impact your fertility or might have a negative impact on your chance of getting pregnant or your chance of having a healthy baby. So certainly we know that active COVID infection is something that could impact the chance of a healthy pregnancy. So with no evidence that the vaccine would do the same. So again, recommend highly that if you would otherwise get the vaccine, do not let the thought that you're interested in fertility within the given year impact your decision to get that at all. Finally, what have our providers chosen to do? That is a great question, and I can't speak for everyone, obviously. I will tell you there was a tremendous uptake for the vaccine in the Department of OBGYN amongst our providers. Healthcare providers, very thankfully, have been offered early access to that vaccine because we are frontline workers exposed to the virus frequently in our work. So our nurses, our doctors, our folks who work in environmental services, et cetera, have been offered that vaccination here at Prisma Health and nationwide. And I will tell you that a ton of women's health providers have accessed that vaccine, many of whom have spoken to me privately about having just an immense sense of gratitude when they got that first shot, just recognizing that it's a lot of privilege to be in this space right now and to have access to the science and the vaccine to keep us safe. Our midwifery colleagues as well, so within the Department of OBGYN, we have a big family of nurses and doctors and nurse practitioners and midwives, and our midwifery colleagues also were equally excited about access to that vaccine. Other questions? Has anything come in from?
So at the end of the day,
yeah,
we would say that if a woman is considering getting the vaccine, if she's pregnant, if she's breastfeeding, that would be a good and a safe choice for her.
That's exactly right. So question being, what is the appropriate time if a woman's considering getting pregnant, if she is pregnant, et cetera? What I would say is that the moment you have access to that vaccine, that is the safer choice for you than being an unvaccinated person out in a population with endemic COVID infections. So the appropriate time in your reproductive life is the moment they tell you you have access to that vaccine, which right now for many of you, unless you're in that frontline group, because our reproductive age folks are not obviously in that older over 70 group, it really would be healthcare workers today. But our hope is in the next few weeks that will open up widely, and as soon as you have an access point, my recommendation would be for you to strongly consider going ahead and going and getting that vaccine and starting your course. Let's see, a few other things. mRNA vaccines, yeah. So question just about how mRNA vaccines work. They are really a fascinating type of vaccine. For those of you that love science, you've probably done a lot of reading already and understand the technology really well. The idea behind vaccination in pregnancy vaccination in general, is that we give the body something so that it recognizes a foreign item, a foreign virus, a foreign bacteria, or a certain protein or sugar that represents that bacteria or virus, and that your body builds an immune response that has memory, that will hold on over time, that will endure, so that if you are exposed to the actual agent, it is not a first exposure, so that you are essentially armed and prepared. You know what that looks like. mRNA vaccines are actually just a very finessed way to do that. So the coronavirus on its surface has a series of what are called spike proteins. That's what gives it the corona name. It looks like a crown, and they're very showy. So very quickly after the virus was identified, geneticists had the code for the entire virus, and they were able to figure out what piece of RNA encoded that little spike protein. That snippet of mRNA, of messenger RNA, has been wrapped in 2 little layers of essentially lipid, of fat, and that is the vaccine. The vaccine, that little area, that mRNA gets into the body, it gets into our host cells, it can't get near our nucleus, into our DNA, our genetic material, that is highly protected. But that mRNA, the coating actually dissolves it, it goes away, and you just have the mRNA. Well, that mRNA gets translated by our host ribosomes, like the little pieces that make the proteins. They read the code, it's like an instruction manual. The ribosomes then make that little protein, that spike protein, and they present it on the cell surface of our body cells to our immune system. There are these almost little holders called the MHC receptors, and the spike protein goes in the MHC receptor, and our body sees it and says, oh, gotcha, I know that I need to do something with that. They make an immune response, antibodies. There's a really fun cycle that happens where it amplifies its own response, and you get this host of immune antibodies that are sitting there ready in the event that you are exposed at your local Harris Teeter or your local school or church, wherever it may be, a cocktail party, and you are ready with antibodies so that the body can knock out the infection if you're ever exposed. So it's really clever. It is not particularly scary. It's actually pretty smart, and I'm thankful to have it in my body right now. Any other questions?
I think so.
Okay, wonderful. Well, Greenville, if you have any other questions, we at Prisma Health are delighted to help you. We do recommend masking all the time. I am much further than 6 feet away right now from other folks, but recommend masking, hand hygiene, and just being really safe right now. We are going to get through this. We're going to be fine, but take really good care of yourself and reach out to your healthcare provider if you have any questions about vaccinations. Thank you.